host, Catherine Maley, and today's special guest is Dr. Victor Ferrari. Now, Dr. Ferrari is a board-certified plastic surgeon who's been in practice for 20 years in Matthews, North Carolina, and that's a suburb of Charlotte. And I've known him forever, and he's wonderful. Now, his practice is called Premier Plastic Surgery Center, and that includes a gorgeous office with its own nationally accredited, state-of-the-art, in-office, private surgical facility for your safety and comfort. I actually personally love when the surgeon has an OR inside. I don't like hospitals. I think they're scary and dangerous and germy. So I love that he has his own. Now, Dr. Ferrari's performed more than 11,000 surgical procedures. Not many surgeons can say that. Now, some of them on well-known celebrities and professional models from all over the world. And he prides himself on natural-looking results, which is what we all want, right? So he's a respected authority who's often featured on TV, magazines, and radio, and he's even won numerous awards, such as 10 Best Plastic Surgeons by the American Institute of Plastic Surgeons and Top Plastic Surgeons Reviews from the internet. Now, as a matter of fact, he's even written a book, and it's called, what else? Body by Ferrari, and Ferrari spelled just like the sports car. And you can get his book on his website, which I'll give you the link later, or you can get it on Amazon. Now, Dr. Ferrari, the thing that differentiates him the most from all other surgeons, he is one of only 5% of surgeons who can match his credentials. So I'd like to start there. So first, I'd like to welcome Dr. Ferrari to our program.
Thank you, Catherine. It's good to be here.
Sure. And then can you do me a favor? Can you just explain why you can say you're only 5% of other surgeons who can match your credentials and training? What did you do differently that they didn't?
Well, most plastic surgeons, the training is much shorter than what I went through. When you finish medical school, most plastic surgeons will do 2 or maybe 3 years of general surgery and then a couple more years of plastic surgery residency, and then they can take their boards and be board certified. When I went through training, I did a full 5 years of general surgery training. And the 5th year I was the chief resident in general surgery at the university where I was. I got board certified in general surgery. And then I did a full 3 years of plastic surgery training. And I was the chief resident in plastic surgery at the University of Miami when I was down there. So most surgeons haven't done 8 years of training. And in addition, I did 6 months of a craniofacial fellowship in Miami as well. And so it's just a lot more years of training, a lot more years of experience before actually going out into practice and doing what I do.
That's such a big deal because most patients who want surgery, they have no idea what board certified means. To put it in context, after you go to high school, most people go to 4 years of college. After that, most everybody just quits and gets a job. Some of us, like I went to business school, so that was another 3.5, 4 years. And then I got a job. You guys were still in school for another, 14 years, like school and training. They need to understand the years and years that goes into learning your craft. So when somebody comes in and says, I'm a cosmetic surgeon, holy cow, that's not a board certified plastic surgeon. I think it's a really big deal that most consumers don't really know the difference of.
Yeah. You know, a lot of people ask me, why did I do so much training? If I didn't need to, why did I do that? And I guess one of the main reasons was I thought I might want to do mission work someday. And if I was trained in general surgery and plastic surgery, I would be much more useful in the mission field. So that's really one of the main motivators, on top of the fact that I would be a much safer and better surgeon having more experience before I went out on my own.
Gotcha. By the way, did you ever do any mission work?
Oh, yeah. Probably every year or two, I try to do a medical mission somewhere in the world, usually a third world country where they don't have much in the way of medical care. And it's funny, when I go to these places, you kind of take whatever procedure they give you. Like, I remember the first trip I went on was in Africa, and I said, hey, how can I help out? And they said, well, we need to have a craniotomy done in room 1. And I was like, wait a minute, you mean like drill into the skull? They're like, oh yeah, the guy's got to bleed. Can you do that? I said, no, somebody misunderstood. I'm a plastic surgeon. They go, yeah, but you're the most qualified guy here to do it. So that was my first case on the mission field, was drilling into a guy's skull. They
Please
also
tell
had
me
other
you
stuff
did.
for me to do, like cleft lips and burns and things like that. But the first day was a little bit of a shocker. But the guy lived and did great, so I must have
Oh,
done
thank
something
God.
right.
Yeah, wow, talk about working under pressure. So there's one topic that we have to talk about because it's the only topic going on in the world, and that's the COVID-19 pandemic. While we are viewing or videotaping this, a lot of surgeons went back to work. So where are you at in North Carolina? What phase are you on, or what's your situation with COVID-19?
Yeah, last Friday was May 8th, and our governor released us to phase 1. And so this week we started seeing patients again and started doing surgery again. We're doing surgery on just the healthiest of people. We don't want anybody to, possibly end up in the hospital. So they're short cases right now, less than 4 hours. We're doing them here in our office. We have all the advanced personal protective equipment here. We've upgraded our air filtration system in the operating room. We've always had a system in addition to the normal system where it kills all viruses and bacteria in the OR. We've added some other filters. We're testing everybody ahead of time because we want to make sure that nobody has active viral load on board, because that would make them sick. It's like influenza. If you knew you had it, you wouldn't undergo surgery because then you'd really get sick with it. So we're testing everybody very carefully to make sure everybody's as safe as possible.
Oh, glad to hear it. By the way, how did you ever get into this? I'm always fascinated to know, how does a surgeon become a surgeon? Are you a little kid saying, I want to be a plastic surgeon? How do you even know what that is?
Yeah, that's a good question. Yeah, my dad was a doctor. He was an anesthesiologist.
Ah,
And I wasn't interested that much in anesthesia because I like to work with my hands. In fact, my first job in high school was a truck mechanic. I love mechanics. And so I thought I was going to do orthopedic surgery. But when I was in medical school, I fell in love with plastic surgery. And the main reason is because it's more of an artistic thing. Orthopedics is a great specialty, but it's kind of nuts and bolts, the bone's broken, here's how you fix it. Plastic surgery is much more creative. For me, it lets me beautify people or make people, it's like, say they need reconstruction, make them look normal, or make normal people look really beautiful. And that to me is very rewarding, to be able to step back and go, this is what I've been able to do to people. I mean, it totally changes people's lives. And we've seen it over and over again. The classic is, a woman who's a little bit of a wallflower, and we do something to beautify her, and all of a sudden she gains confidence. Next thing you know, 6 months later, she's engaged to be married. I mean, it's just a lot of stuff happens. It can really be a wonderful, life-changing thing, and that's rewarding. We get thank you cards from people all the time. They call us. They've invited me to their weddings. I just feel like it's a big family thing.
well, I can say firsthand, I've had plenty of surgery in different phases of my life, and it's been for different reasons. But as I got older, when I was younger, it was just to feel more confident. But as I got older, it was more to buy some time. I wasn't ready to look old. I just, I didn't mind getting older, but I didn't want to look old. So it's funny how it changes. You still want it, but for different reasons. Yeah. So is there anything in particular you love about plastic surgery versus, like, do you ever wish you went with the anesthesia route instead?
Not really. I love everything about this profession. I love the people we work with, in terms of getting to know them initially and seeing what their desires are. I love the technical aspect of it. I love the artistic aspect of it. I love the medical science aspect of it. I mean, it's just very fulfilling to me. I can't wait to get to work. So the last 2 months when we've been at stay at home, I mean, I've been coming to work anyway, even though we weren't really seeing patients, just preparing for this day when we would reopen, because it's such a wonderful profession. It fits me perfectly.
Well, there are many consumers who can't wait for you to reopen. I do, and I know personally my Botox wore off a long time ago. So yeah, I mean, all of us need to get back into the swing of things. So tell me, give me the 3 procedures you like to do the most and why.
The most common things, and they've become that, I guess, because it's what we do the most of. Breast augmentation is the most common. liposuction, and then advanced body contouring such as tummy tucks or circumferential tucks, or surgery after major weight loss or mommy makeovers.
By the way, for those who don't know, breast aug's not just popular, it's like 330,000 women do it every year. And then lipo is right up there with like another 150,000 per year. So those two procedures are so darn popular, and never lose it. They've been on the top 5 list forever. I've been doing this 20 years, you know, been there a long time. So do you want to show a few photos? Let's show, if I can make this work, let's show a couple photos of Dr. Ferrari's work. So Dr. Ferrari, can you just tell tell us the story, tell us what we're looking at here.
Yeah, this woman was around 30 years old at the time she came to see me, and she had seen 4 other plastic surgeons that told her she had a very complex breast deformity. And she does 2 things. She has what's called constricted breast, which means the breast is too tight. It didn't form normally. And number 2, it's called a tuberous breast. Tuber is like potato, because if you look at the shape of her breast, it looks like little potatoes coming out. So these are very complicated. And all 4 surgeons told her it would be a staged procedure where they would have to put in what's called tissue expanders to stretch everything out, and then come back another day and put implants in and try to, you know, make the areola look normal. And all 4 told her there was a 100% chance she would lose nipple sensation. And when I saw her, I said, yeah, you've got a complex case, but we've done a lot of these. We can do this in 1 stage, and you've got about a 2% chance of losing nipple sensation. So this was a 1-stage thing, 1 day of surgery. This, the after photo is seen 3 months later, and she had all 100% of her nipple sensation back. And she was just so excited. She's one of the ones that still occasionally, and this was years, this was probably at least 10 years ago, she still, you know, occasionally calls and says, you know, I'm doing great, you know, now I got another baby, whatever. An interesting thing about her, a reporter from England called me one day and said, that's one of the best cases I've seen. Is there any chance I could talk to that woman? Because I'd like to do a story on her here in a British journal. And sure enough, the patient was willing, and they had a conversation. And so her photos also showed up in a British journal that talked about breast issues.
Well, I can certainly say she got a wow result. She must love you. And then how about the next one? If I can turn this thing. Let me see. There it is. How about that one?
Oh, yeah. This woman was 32 at the time that she came to see me. Her original surgeon had created what's called synmastia, or in layman's term is called uniboob, where it's kind of like one breast. And he had put saline implants under the muscle. Well, if you think about the pec muscle, it's stuck to your breastbone. So what had happened, he was trying to get tight cleavage, and he actually lifted the pec muscle off the breastbone, and these 2 implants were actually touching each other in the middle. So he was not sure how to fix this, and he told her it can't be fixed, which is not true. So she came to me, and what I did, I took them out. I expanded the pockets laterally and closed off the pocket near the breastbone using her own internal tissues. And the photo on the side is seen 3 months later. And she did great with it, had no complications or issues, did not lose nipple sensation or any other problems with the surgeries.
That's amazing. So you're doing a lot of revision work from other surgeons?
Yeah, I trained in Miami with a guy named Dr. Ralph Millard, and he was world famous plastic surgeon. And people would send him cases from all over the world, literally, that were complex, and they didn't know what to do. And so I trained with him as to how to analyze a problem and how to fix the problem. So he was really my mentor. He's no longer living, but he was my mentor to be able to take on these hard, challenging cases and give people really great results with it.
It's almost like you were doing the botch show before the show was even formed.
Yeah, exactly.
You got a great result there, boy.
Thank
and
you.
then here's the last one. What's going on here? Wow.
Okay. This woman was 36. She was a mom. She had lost about 80 pounds on her own. And you can see she just has, she looks like she kind of melted. She has kind of these rolls of skin hanging down. And so what I did, and there's more pictures of her on the website all the way around, I did liposuction and what's called a circumferential tuck, where you do a tummy tuck, but it goes all the way around the body, because on people like this, you have to tighten the outer thighs, you have to lift the buttocks, and get the abdomen flat all in the same day. Now, in all fairness, post-op, she lost about 10 pounds on her own. So most of this is me, but a little is her. So, you know, and I think if you look at her breasts, you can tell her breasts have lost a little bit of volume, but I would say 80+% of the result is surgical. Unfortunately, she has the little elastic straps right where the scar goes, but where you see the elastic straps, that's where her scar is. And she's wearing a little two-piece bikini. And I remember when I saw her, I said, my goal for you is to get you in a two-piece bikini. And she said, you're an idiot, because I haven't been in a two-piece since I was 7 years old. I've always been heavy. And so there is no way I'm going to be in a two-piece. And sure enough, she's back in a two-piece.
I mean, this really, I call this life-changing work. I used to think plastic surgery was pretty fluffy, because for me it was. Like, I didn't need it. But you're changing lives with these kind of results. Holy cow.
And that's the beauty of what I do. That's why I love it so much.
Well, good for you. So Dr. Ferrari, I know a lot of people watching this are going to have a lot more questions. They're going to want to know things about scarring, like you just mentioned, financing, or, you know, the cost of things, pain, downtime, results. Do you want to just give like just a brief journey of a surgical patient? Like, what would they expect if they came to see you?
Yeah. Well, the first thing would be our patient care coordinator would spend some time on the telephone, talking to them, see what their desires were, and make sure this is the right place for them before they even come in here. When they get here, we give everybody a complimentary copy of the book that I wrote, Body by Ferrari, because it has a lot of great information in there, not just about the surgery, but one of my biggest things is when people are properly nourished, they're going to do better with surgery. They're going to recover faster. They're going to have fewer complications, and their scarring is going to be much better. If you give the body the right building blocks, it can heal just about anything. So there's a whole chapter dedicated to that in the book. There's also a lot of preparation of what you can do before surgery and after to get a really good result. When we come in to the office and see a consult, they first meet with the patient care coordinator briefly. Then I meet with them, talk in detail about their desires and what they're hoping to get out of it. And then after a quick exam, we sit down, we talk in detail about the procedure, we look at before and after photos, and hopefully in the actual real life photos, there's somebody that kind of looks like them so we can see what a realistic view would be. You know, a lot of doctors do these morphing programs where you take a picture of the patient, you morph, and you go, this is what we can do for you. Well, it's easy to do anything on a computer, right? But if you look at actual work that the doctor's done, to me, that makes more sense. We have those morphing programs, but we kind of quit using them because the computer is infinite what you can do, but that doesn't mean that that's what the physician can do the day of surgery. Mm-hmm. Then they go schedule a visit with one of our nurses, and it can be a virtual visit or an in-person visit, but in great detail, the nurses will go over pre and post-op care, their medications, the consent forms, everything they need to know, and ideally their significant others there as well if they're the ones that are going to be taking care of them. Our OR is nationally certified. We only use board certified anesthesiologists. You know, most plastic surgeons will use nurse anesthetists, which nothing's wrong with them, but I think the anesthesiologist has a little bit higher level of training. If they have to spend the night, we have an overnight facility here in the office, because when we do big cases, more than about 6 hours of surgery, we would keep them overnight. For certain things like liposuction, we also provide a lymphatic therapist to help drain the fluid out so their recovery will be faster and the swelling will resolve much quicker.
So
and I think the
is
better as well if you get the swelling down quicker. We also do a lot for scar care. For example, all the stitches we put in are on the inside and they dissolve. They take longer to put in than external stitches, but the internal ones will last for months, and so they'll hold the skin together and make a better scar. And we also have a special glue that we put on there called Dermabond. And then for bigger cases, it's Dermabond plus what looks like a little mesh. And these, it doesn't sound like much, but the glues and the mesh and everything that we put on scars, they can be hundreds of dollars worth just for the dressing itself. But I guarantee you the scar is going to be much better in the long run. So I think it's well worth it.
I learned something there. I didn't realize that's the scarring thing. I didn't even realize you could do internal scar, internal stitches. That's a really big deal because a lot of patients have some scars that are intense. And if you're going above and beyond that to make that scar as minimal as possible, that's kudos to you.
Oh, well, thanks. And the reason sometimes the scars are going to widen on you is because external stitches are used. Typically, they would come out about a week later. Well, the day you take the stitches out, the support's gone, right? So now the scar has to rely on 1 week's worth of healing. Well, that's not much time. So then they tend to widen on you or get thick on you because the body's trying to heap more collagen on there to try to give it some strength. If you put internal ones in, they're taking all the tension off. So you tend to have a much thinner and prettier scar.
Wow, good to know. I can't believe I didn't know. That's good to know. By the way, Dr. Ferrari has offered anybody who's watching this, the audience can have a free virtual and or live consultation with him in his office in Matthews, North Carolina. And all you need to do is call 1-800-NEW-YOU. And I'll also put all of his contact information in the show notes. So Dr. Ferrari, tell us something we don't know about you.
Well, one of the things people are surprised to hear about me is that I was born in Argentina and I speak fluent Spanish. And it's funny because sometimes, like I lived in Miami 6 years, and one time I was in an elevator and you had the little badges in the hospital. Well, I didn't like the picture they put on there. So I took Fabio's picture, cut it out and taped it over mine on the badge. And these two girls walk into the elevator and they look at my badge. And one of them says to the other one in Spanish, "He looked much better with long hair." Not knowing that I understood. So I turned around and said, "Oh, well, thank you very much." Well, of course they were embarrassed. Yeah, I speak Spanish fluently. The other thing, I am surrounded by women all the time. I mean, all my staff is female. We have 9 full-time and 3 part-time people. At home, it's my wife and 4 girls. My girls are ages 24 to 17. The only thing that's male near me is our new dog, Georgie. He's a little Maltese. He's like
he is adorable.
He is the cutest little thing. And he and I have like this male bonding thing going on because everywhere else I'm just surrounded by estrogen all day.
I don't know how you do it or how you have done it all these decades. Wow, that's a lot of women and a lot of female. Yeah. By the way, if you check out Dr. Ferrari online, you will see he is an excellent water skier. Excellent. Have you been water skiing forever?
I started when I was 14 years old. The guy that was dating my older sister taught me how to water ski. And we've been friends just about ever since. And I just started loving all water sports. And now do paddle boarding or canoeing, or jet skiing. Just anything on the water is just fun for me.
But with water skiing, if you haven't, doesn't every bone in your body hurt after a day of water skiing because you're using every muscle in your body?
I would say the bones, but sometimes the muscles are a little bit.
I mean, the muscles, yeah.
Yeah, I'm not used to using those muscles.
Right.
I like to work out, 4 or 5 times a week. But yeah, when you water ski, it's a different thing. And I push myself to the limit because I think the harder you push yourself, the more fun it is.
And that's why you're an excellent surgeon. So, Dr. Ferrari, how can our audience find you online?
Well, there's a few ways. Our website, of course, or you could just Google Victor Ferrari, but our website is natural-lookingresults.com. On Instagram, it's Dr. Ferrari, Dr. Victor Ferrari. And then Facebook, the name of the practice is Premier Plastic Surgery Center.
Oh, gotcha. And in case you can't remember, just look at his little red sports cars over there.
It's literally Ferrari, like it's spelled like a Ferrari. What a great name you have for our industry. It shows quality, and you are quality, so that all makes sense. Dr. Ferrari, thank you so much for your time. We really appreciate it. And again, for the audience who wants to have a consultation with the Dr. Victor Ferrari, please call the 1-800 a new you phone number, and or check him out online in his Instagram. Okay, thanks so much.
Thank you, Catherine. Appreciate it.